and I am therefore honored and humbled to have been asked to give the Krishna Raj Memorial Lecture, and particularly to share the dais with Armando, whose narration of the experience from Brazil is truly inspirational for all developing countries and particularly to India. I am grateful to all of you for the warm welcome that has been extended. I arrived this morning from Delhi, bundled in more cloth than an Egyptian mummy, and that's where I'm headed back tonight. But therefore, this interlude in Mumbai, with all the warmth of sharing the experiences with fellow-minded public health activists, is really wonderful indeed. Though I've been introduced as the chairperson of the high-level expert group, which has been commissioned the task of developing a framework for universal health coverage in India, I must confess that the work has just begun. We were commissioned in October, mid-October to be precise, and we have about 8 months to complete our task, though we've been asked to provide some sort of a preliminary report by end of January if possible. So the discussions are still very much on. Therefore, whatever I speak today is partly from a personal perspective, though some of the learnings that I have acquired through interaction with my colleagues in the committee, as well as from a number of representations and presentations that we have received, would also be reflected to some extent in my thought process. But I will put in the disclaimer that I'm not speaking on behalf of the committee, because it would be incorrect and premature to do so. In fact, even having been asked to give a talk on universal health coverage when we are just so early in the process, and particularly having been conferred such a great honor as the Krishna Raj Memorial Lecture, is even more premature and puzzling than Obama getting the Nobel Prize before he started doing anything. Anyway. Armando challenged us as to look at the political context. He repeatedly reminded us that universal health coverage cannot be divorced from the political context. It is not merely health, but it's not merely just the social policies, but it's not just the economic policies, but the entire political context that has to be taken into account. So let's look for a moment as to why universal health coverage has suddenly become a very major area of consideration globally, and particularly in India at this point in time. Do these factors spell potential success, or are there traps lying in wait for any framework that is developed, particularly through such a consultative process? I would say that the interest in universal health coverage, of course, has come in from the rights-based movements globally, particularly the social movements that have been sparked across the world. And the fact that right to health is something that is inalienable is something that even the civil society in India has begun to vigorously articulate, and that does spur some degree of response. However, again, in the context of the right to education as well as the right to food security. But it is not merely the rights-based approach that probably determines the political response, particularly in our country. So we'll have to look at what are the other determinants. Clearly, there is also an economic interest. The economic interest is partly made by the case that productivity is best protected when we have universal health coverage and adequate health services available for people, so that the demographic window of opportunity that India has of having a very young population and continuing to have a very young population for the next 3 to 4 decades, with a quarter of the world's entire workforce being contributed by the working age population in the age group of 15 to 59 years being located in India. And how can this particular pool of human resources be adequately harnessed if we do not invest adequately in education, skill development, and protection of health through investments in public health? So that's a legitimate argument that can be made, but with a relatively narrow economic interest of economic productivity. But then that argument would also have a flip side. Because if we were only to take a human capital approach, then we would be neglecting the rights of those who are unemployed, those who are retired, those who are elderly, those who are infirm, those who are children, and therefore we would be neglecting large segments of a population, and therefore we have to complement that at any rate with a rights-based approach if you're looking at equity in all dimensions. So you have to move beyond the economic argument. Then, of course, there comes the question of healthcare costs. We have had a situation where healthcare costs have become major threats to economies world over. And some of the shivers that the World Economic Forum has had and they're talking about universal health coverage, they're talking about health as a very important issue for the last 3-4 years in Davos as well, is because of the experience that has happened in the US, where healthcare costs have been perceived to be one of the major threats to the economy. And indeed, the General Motors has run itself into bankruptcy, and towards the end of that period, became more of a healthcare company with automobiles as an ancillary. So they were spending more on healthcare than on steel. So if that was the situation, then obviously the world of commerce also realized that unaffordable healthcare costs can be threats to economy. So the question of how best can we actually protect health so that we can reduce healthcare costs came into the debate. Then came the question of health systems. The other debate that's going on, and which is not only parallel but intersecting, is the whole debate on health systems. Suddenly, health systems have become very important in the international health dialogues in the last 3 years. This is because now there is belated recognition that most of the vertical programs of health have failed to deliver adequately. And even simple technologies which are already available, leave aside the innovative technologies which are currently being funded with great amount of money being put into it, even the available technologies are being very poorly delivered across the world. There is a technology pile-up in a number of areas. And given that, the disenchantment with having only vertical programs has resulted in thinking of a greater degree of health system strengthening in order to integrate to some extent at least some of the programs, but at least to create a sturdy delivery system. Now, whether you're talking in terms of horizontal integration or diagonal integration, the jargon keeps to be growing, but the fact that a sturdier health system is required for delivery of even vertical programs is something that has come in as a recognition. So when you're talking about the health system as an integrated whole, you cannot then divorce it from the conversation about universal health care as such. So again, that has become an interlinked process. Next, we have also suddenly started having a greater political debate on the role of the state. One of the benefits of the global economic crisis has been to remind that the neoliberal economic argument that small government is the best thing for the world is absolutely a falsehood. We have seen the global economy under threat because of the abandonment of the regulatory role of the state. We have seen public services crumble because of pure privatization. And while these lessons may not have been universally absorbed, and you still have the Republican right and the European conservatives still dominating the political debate, nevertheless, the fact that the state has to exercise a judicious, within quotes, a stewardship role or a regulatory role, or a role that certainly has to be much more attuned to protection of public services and public good, is something that has now become a part of the debate again. Whereas in the 90s and in the early part of this century, the role of the state was not even meant to be discussed in any forum, any policy forum. And we have ourselves seen our history has evolved. At the dawn of our independence, with a tilt towards a socialist mindset, we did think of a strong public sector as the vehicle for delivery of health services. We had the Bohr report as well, suggesting that community-based healthcare and primary healthcare are the things that need to be supported. But with gross underfinancing of the public sector, there was no way that particular aspiration could have ever been achieved. And by default, we have had a disorderly growth of the private sector, which has grown over the years in an unwielthy, unregulated manner, and not only has not delivered the care to the extent that is required, but has actually compounded the problems in many areas by escalating healthcare costs and by also